We're here today with Erica at Dr. Sheetal's office, who recently had an implant done. How are you doing, Erica?
I'm doing fine, thanks.
So the implant was for one of your front teeth, is that right?
Yeah, it was one of the front teeth.
Wow, yeah, you can't even tell, so
I know,
that's pretty good. Yeah,
I'm so excited.
yeah,
so
that's
happy.
yeah. So when did you lose this front tooth, or what happened? What was the deal?
Actually, I never had it. So when I was a girl, when I have my first teeth, I never had it. The only thing I had is like a front teeth. It was wide and like a little line in the middle.
Okay.
But after when it came to my permanent teeth, that teeth never came out. But
Really?
it didn't look because my teeth was like all crooked, so you can't
Okay.
see the space.
So you just lived without that tooth, and
Whole life.
you just never knew what it would be like to have
Yeah.
one, right? Yeah.
Yeah.
Okay. When did you decide to get an implant? What got you to get this problem fixed?
Because I get an orthodontist treatment, so after that you can see the space in the front. So they told me that I need the tooth. So they put my retainer. It was with the acrylic tooth attached to it.
Right.
So of course I need my implant. So I didn't want a bridge because I don't want to do anything to my other teeth. So I was decided to make an implant.
So you were at an orthodontist.
Yes.
And he said, and he did his work, but he said you got a gap. We can't help you.
Yep. And they told me that either you get a implant or you can get your bridge.
Oh, okay.
But I don't want to do anything to my teeth.
Yeah.
Right.
Oh, great. And so, are you happy with how it went?
I'm really happy because I waited for 6 years for this. So now I'm so happy with my teeth.
So the procedure, I know there's been a lot of developments in implants lately. I mean, how was it? Was it painful? You can be honest about that. I mean,
No pain at all. She gave me a prescription for my painkiller. I went to the pharmacy and get my painkiller, but I didn't have to take any pill at all.
Really? So you didn't use any pain meds? And you really didn't hurt? Wow. Was it a long procedure when you actually had it done? Or?
Wait, it is long because you have to wait for, I'm not really understanding about this, but you have to wait to the screw, I guess, attached to the bone and all this stuff. But it's worth it. The wait is worth it.
But you actually, when you're in the chair getting the implant put in, does that take a long time, or was it pretty fast? Maybe take like an hour. Really? Okay.
Yeah, it's not that bad.
So basically you had a new tooth in an hour, right?
Yes.
Yeah. Wow.
Yeah, you can say that way.
So are you married?
Oh, yes.
Yeah.
I am married.
So did your husband recognize the difference, or what is?
The night before, I told him, okay, lick my smile because it's the last day you see my smile with the wire. So the next day when I came at home with my new tooth, he's like, you look weird without the wire in the front. But he liked it.
Well, that's great. That's great. Do you smile more now than you used to? Do you notice any change?
Well, actually, I am a smiley girl. But yeah, of course I do smile more. And I even post it every day on my Facebook, like, look my new smile. I'm so excited about it. So happy.
Oh, that's great. So you're doing more posts with images now, huh? That's great. That's great. So would you recommend if somebody has a need for an implant or work that they come to Dr. Gokhale or Dr. Sheetal?
I do definitely recommend it because I think it's something that is worth it, and it's something that you can't really tell and it's something that you don't have to do anything to your other teeth, which is, I think it's good that you don't have to damage your other teeth in order to get your teeth.
Great. So if somebody's thinking about it, would you say do it? Or?
Yes, definitely.
Okay.
I won't think twice. If I have to do it again, I will do it again. Yeah.
That's pretty good. That's pretty good. All right. Well, thank you for coming in. I appreciate you sharing this with us.
Thank you.